All right, good afternoon. Welcome to our Veterans Service Officer Asbestos Claims Development Training. My name is Aaron Munz. I am the Veterans Director at asbestos.com at the Mesothelioma Center. I am going to record this presentation, so if you have colleagues that weren't able to join us, we can get this sent out to them. I'll record it and upload it to YouTube and have a private link, and I'll email that to all of you as soon as it's available. So today we're going to focus on learning about asbestos diseases, the conditions that the VA recognizes, and how to assist the veterans in your community. The Mesothelioma Center is a free claims or a free information center that helps patients all across the country, including veterans. We work with thousands of patients every year who have been exposed to asbestos that are in some stage of dealing with asbestos disease, whether it's exposure and they're starting to experience symptoms and looking to find out how to get tested, to patients who have been diagnosed with advanced stage mesothelioma cancer and are trying to connect with resources. Our goal, my goal as the Veterans Director, is to make sure that every veteran who contacts us understands the VA benefits that they may be eligible for and connects with their local veteran service office so they can apply for the benefits that they may have earned through their service. We support veterans in a variety of different ways. We provide information and support literature that includes everything from information on symptoms and how to get diagnosed to information about asbestos cancers, treatment options, nutritional information, support and emotional support literature to talk about how to deal with the impact of a terminal disease on a family. We help provide information about our doctor match assistance for mesothelioma patients. Mesothelioma is a rare cancer that we'll talk about. There's about 40 specialty centers in the country that have the expertise to help treat that rare cancer, including several in the VA system. We also help veterans connect to specialty centers that are associated with medical centers across the country at the community care centers. We provide information about financial help, which may include travel grants, legal assistance, VA benefits, as well as information about drug assistance programs that can help with copays, and information about VA benefits. So today we're going to be focusing on VA claims evidence development. We're going to be focusing on the asbestos diseases, medical nexus statements, and asbestos exposure summaries. And as I mentioned, something that I try to do with every veteran that I speak with is connect them with you. I want them to connect with the local service officer who can make sure that they're eligible for and applying for all the possible benefits that they and their families are eligible for. So the elements of a successful VA disability claim for asbestos. Asbestos is a little bit different than some other medical conditions because asbestos has such a long latency period. The average latency period, the time from a veteran is exposed to asbestos to when they're diagnosed, is typically between 20 and 50 years from their first exposure. As a result, almost none of the veterans that we work with are diagnosed with an asbestos illness while they're on active duty. Most do not have any complaints or anything noted in their active duty medical records about breathing problems or asbestos disease because it takes so long to develop. So because of that, you have to both prove that the veteran has a valid diagnosis, that they have a condition that was directly caused by asbestos exposure, but you also have to be able to prove that the majority of their exposure to asbestos throughout their lifetime occurred on active duty. Because of this, nothing is presumptive for asbestos claims. You have to prove both the medical connection and the military exposure. So I mentioned the latency period. The average latency period is between 20 and 45 years. It can be a little bit shorter, and often it's more than 45 years. I'm working with a veteran this week who was diagnosed with mesothelioma in the past couple of weeks, and it's been well over 50 years since he was on active duty in the early 1970s. So it can take longer for some patients. The VA, most of the information in this presentation comes from the last July's update, the 2021 update of the M21-1. And the M21-1 states that the average latency period ranges from 10 to 45 years or more between first exposure and development of disease. It also states that the amount of exposure to asbestos can be brief and/or indirect. So the veteran may not have a lot of exposure to asbestos in order to cause a life-altering condition decades later. Some other things to note is that smoking does not prevent an asbestos claim from getting approved by the VA, but the VA does not recognize that COPD, emphysema, or chronic bronchitis are primarily caused by asbestos. Those three lung diseases fall into the obstructive pulmonary disease category. We'll talk a little bit about the diseases that asbestos causes, but asbestos affects the lungs differently. It causes restrictive lung diseases and interstitial lung diseases. So if the veteran has an obstructive pulmonary disease, and COPD is the most common lung disease diagnosed in the United States, the VA will not connect that to asbestos unless it's secondary to an asbestos lung disease. So let's talk a little bit about asbestos. Asbestos is a naturally occurring mineral. It is mined from the ground, and it's used in a variety of different materials. It is cheap, it is fireproof, it does not burn. So as a result, it was used as a insulating, fireproofing, and strengthening material in hundreds of different products that were used throughout the military up through the late 1970s. And then OEM and inventory was used up throughout the 1980s and into the 1990s. Asbestos was used primarily in insulating products. It was used on the pipe lagging that wrapped all of the steam pipes and hot water pipes on Navy ships. It was used on engine wraps and to insulate wiring harnesses. It was used on all types of vehicle brake shoes and brake pads and clutch assemblies on wheeled vehicles, tracked vehicles, rotary wing and fixed wing aircraft. So it was used across all branches of service. Asbestos is not dangerous when it's new or in a solid form, but when it is broken apart either through friction or during a maintenance procedure or through wear and tear, those fibers break down and are released as dust into the air. Asbestos dust can enter the body two ways. The most common cause of asbestos damage is lung disease. So you breathe in those asbestos fibers and they get embedded into the lung tissue. You can also swallow those fibers and they get into the gastrointestinal tract and the urinary tract. Once the little fibers, which are microscopic, they are 1/20th the diameter of a strand of human hair. So they're very, very tiny. You can't see them unless you can see them in the air. When sunlight is kind of coming through the window, you could see that those little fibers floating, but they're very, very small. The structure of asbestos, if you look at them under a microscope, they look like little fish hooks. They have barbs And those barbs, once you inhale them or swallow them, they get into your lung tissue or your digestive tract, and the little barbs embed into the tissue. So once the fibers enter your body, they never come out. You can't cough them up, you can't excrete them out through your bowels. They're stuck in your body. Over the course of time, those fibers embed into tissue, and your body forms scar tissue around each one of those individual tiny little fibers. It's kind of like if you get a splinter in your finger and you don't take it out. Over time, your body will form calcified tissue around that, harder tissue around that splinter. The same thing happens in your lungs, in your digestive tract, and into your urinary tract. That scar tissue, if enough of it builds up over time, it can cause damage to your lungs. It can reduce lung function. It can also cause damage to the DNA of the cells, which can mutate into cancers throughout the body. So the conditions that the VA recognizes can be caused by asbestos are fibrosis of the lung tissue. The most commonly occurring is interstitial pulmonary fibrosis. When interstitial pulmonary fibrosis is caused by asbestos exposure, it gets re-diagnosed or renamed as asbestosis. Interstitial pulmonary fibrosis can be caused by a variety of different things that are inhaled into the body. It can be caused by wood dust, fiberglass, silica, variety of different things. But when it's caused by asbestos, the doctor, the pulmonary doctor, can re-diagnose this or rename it as asbestosis. Asbestos can also cause tumors throughout the body, the digestive tract, airways, and urinary tract. It can cause pleural effusion. The pleural space is the space outside of the lungs, between the lungs and the rib cage. There's a pleural lining outside of the lungs that asbestos fibers can pass through the lung tissue and get caught in the pleural lining. The pleural lining is a denser tissue in the body. It gets caught there, and then scar tissue can form. When scar tissue forms in the pleural, it's called pleural plaque. When the pleural plaque rubs on the inner lining of the rib cage, it creates friction. Normally, when you breathe, your lungs expand and contract, and your body has a thin layer of fluid that lubricates that contact point on the outside of your lungs and the inside of your rib cage. When there's scar tissue, there's friction on that contact point. So when you breathe, your body forms extra fluid to help lubricate that contact point. That extra fluid can build up in the pleural space between your lungs and your rib cage. If enough fluid builds up, it can compress and collapse the lungs, can reduce the overall lung capacity and cause pain and pressure and reduce breathing capability. That's often the first serious sign, and sometimes how veterans get diagnosed with an asbestos lung disease is when they go in for an x-ray because they're having chest pain and they identify a partially collapsed lung because of fluid compressing the base, the lower lobes of the lung. Pleural fibrosis is scar tissue buildup in that pleural lining. It can also cause mesothelioma cancer of the pleura around the lungs and the peritoneum, which is the lining around the abdominal organs and the diaphragm. The VA recognizes that asbestos can also cause cancers of the lung, bronchus, gastrointestinal tract, to include the stomach and colon, larynx, pharynx, and the urogenital system, except the prostate. The VA specifically says that they do not acknowledge that asbestos is a primary cause of prostate cancer. So you can see that the VA recognizes a wide variety of health conditions that can be caused by asbestos. The only ones which are almost exclusively caused by asbestos are asbestosis and mesothelioma cancer of the pleura and peritoneum. All of the other conditions have more common causes than asbestos. So as a result, linking asbestos exposure to the cancer and connecting it with a well-written nexus statement is the key to getting any other condition besides asbestosis and mesothelioma cancer service-connected. Another thing to note is that when you have lung disease, which reduces the overall lung capacity, it adds stress to the heart. When you have stress caused by reduced lung capacity on the heart, it can cause pulmonary hypertension, and you can develop cor pulmonale, and that is a heart disease secondary to an asbestos lung disease. When you have cor pulmonale, that rates as a 100% disabling condition by the VA. So if you have a veteran who has asbestos lung disease, it's important to have them not just talk to their pulmonary doctor, their lung doctor, but also talk to their cardiologist, because they can get a significantly higher rating if it's causing heart failure in addition to the stress that it's putting on their lungs. So how do you get an accurate diagnosis of an asbestos lung disease? It takes two parts. You have to have imaging of the chest, and specifically a CT scan. A CT scan is considered the gold standard for diagnosing an asbestos lung disease. You also have to have a pulmonary function test measuring the lung capacity using spirometry. I've talked to a lot of veterans who have been diagnosed, they had shortness of breath, they talked to their primary care doctor. Their primary care doctor asks them about their smoking history, gives them a pulmonary function test, and diagnoses them with COPD. Without doing the CT scan, without talking about their asbestos exposure, and without referring them to a pulmonary lung specialist. A primary care doctor can diagnose COPD. A primary care doctor cannot accurately diagnose an asbestos lung disease to include pleural plaques, pleural thickening, pleural effusion, asbestosis. So they need a referral to a pulmonary lung specialist. They are the best trained doctors to diagnose restrictive lung disease and interstitial lung disease, the conditions that the VA recognizes. They can also differentiate between COPD and a restrictive or interstitial lung disease. So having the veteran advocate for themselves, ask their doctor for a referral, explain how and when they were exposed to asbestos so the doctor understands and can get the right testing done. Asbestos cancers are going to require a tissue biopsy and a pathology report. There are some types of cancer that can be caused by asbestos and some that have no known association. So getting the cell type of the cancer, specifically for a cancer like lung cancer, which is the most common cancer caused by asbestos exposure, is important. For example, non-small cell cancer, to include adenocarcinoma or squamous cell carcinoma, can be caused by asbestos. But small cell lung cancer does not have a strong association with asbestos exposure. So seeing the cancer, having the scan, getting a referral to a pulmonologist and an oncologist, a cancer doctor, having the tissue biopsy so we understand the cell type is the first step to getting a nexus statement for an asbestos-related cancer. So let's talk about mesothelioma cancer. Mesothelioma is not lung cancer. It affects the lining outside of the lungs primarily. There's 4 different types of mesothelioma. The most common is pleural mesothelioma. That's about 75% of all mesothelioma diagnoses in the year, or each year. Peritoneal, affecting the lining around the abdomen, is about 20 to 25%. And then there's 2 very rare types, pericardial mesothelioma, which affects the lining around the heart, and testicular mesothelioma, which affects the lining outside of the testes. It's not testicular cancer. All 4 of these are associated with asbestos exposure. There's about 3,000 cases of mesothelioma diagnosed in the United States each year. We think that's a little bit lower over the past couple of years because of COVID. There's just been less diagnoses, less people getting to the right specialists and having a diagnosis made. Also, people with asbestos lung disease were more susceptible to having dying from COVID over the past few years. So there's probably less people who were diagnosed. But out of those 2,500 or so people to 3,000 with mesothelioma each year, veterans make up about 30%. So far higher than the overall veteran population in the United States. And that's because the military used so much asbestos across the branches of service for decades. The majority of the veterans that I talk to and I'm working with are in their late 50s to late 70s. They were exposed to asbestos in the 1960s, 70s, and early 1980s during their military service, and are just now starting to experience the negative effects of that exposure. When a veteran has mesothelioma cancer, their pathology report is going to state malignant mesothelial cells. That's how you know it's mesothelioma and not a more common cancer like adenocarcinoma or non-small cell cancer. Patients with mesothelioma, it is a terminal illness. There is not considered to be any cure for mesothelioma cancer. So connecting the veteran to a specialty center where more options can be offered and more expertise, potentially a much more competent surgeon with more experience who does the biopsy for a quicker diagnosis and then is able to treat the cancer more effectively, is in the veteran's best interest. So if you have a veteran who has mesothelioma, we can help connect them to a specialty center. My medical outreach director, Missy Miller, knows all of the mesothelioma specialists in the United States and can help fast track appointments across the country. So let's assume that the veteran now has a diagnosis of a cancer that may have been caused by asbestos, or they have a lung disease that may have been caused by asbestos. The next step is a well-written nexus statement. The wording on the nexus statements for asbestos lung disease are the same as any other condition. It's got to include the connection between the current diagnosis and asbestos exposure. Obviously, we want the doctor to be 100% sure to state that the veteran's lung cancer or pleural thickening lung disease is due to exposure to asbestos. Often there's multiple risk factors. We know that a lot of the veterans that in the 55, the mid 50s to mid 70s range also had a history of smoking. You know, during my service in the Army, I spent 9 years as an armor officer. If you smoked, you got a break every hour from the motor pool from turning wrenches, and you got to stand outside for 10 minutes and have a smoke. If you didn't smoke, you just did more work. As a result, you know, it was almost encouraged that a lot of the guys in the military during this time period had a history of smoking, at least while they were on active duty. That is a risk factor for many of these cancers. It is not a risk factor for mesothelioma. There also has to be a medical rationale for why the doctor is making that conclusion, and it has to be evidence-based. So one of the things that we want to use for asbestos-related illnesses is the latency period. We want them to say that the current diagnosis is consistent with the latency period for asbestos diseases, which again, typically ranges from 20 to 45 years or more. A lot of the veterans that we work with served in the military 30, 40, 50 years ago. So the doctor can say, as part of the nexus statement, I have been treating this patient for lung cancer, for non-small cell lung cancer. This patient has a history of asbestos exposure approximately 40 years ago during their service in the Army, Marine Corps, Navy, Coast Guard. This is consistent with the latency period for this type of cancer caused by asbestos. That can help overcome one of the major objections that the VA comes back with, stating that the veteran was not diagnosed on active duty. For most cancers, other than mesothelioma, the oncologist may not make a connection to asbestos unless there's also what we call an underlying asbestos lung disease. So in addition to the cancer, there's also evidence of some damage to the lung tissue or the pleural lining that is likely caused by asbestos. So if the patient has a tumor in their stomach or colon or kidneys or their lungs, the doctor is much more likely to connect that cancer to asbestos if the veteran also has evidence of a lung disease that may have been caused by asbestos. So the doctor can state that the veteran was diagnosed with non-small cell lung cancer. The patient also has evidence of asbestosis due to exposure to asbestos. Because of the presence of asbestosis and the increased likelihood of developing lung cancer as a result of asbestos, I believe it is more likely than not that this patient's non-small cell lung cancer was caused in part by exposure to asbestos. So we want to have as much information about an asbestos lung disease in addition to whatever cancer there is. And that can help strengthen those nexus statements and make the VA medical examiner less likely to come to a different conclusion. We also want them to be able to refer to the scans or the pathology report in their nexus statement to state that this particular type of cancer asbestos is one of the known etymologies of this particular cancer, or there is evidence of calcified scarring on the pleural lining consistent with previous exposure to asbestos. We want all of that in that nexus statement. All right, so now we're moving on to the next step. The veteran has presented their symptoms, has gone to the doctor, has been diagnosed now with a condition that is caused by asbestos and has a well-written nexus statement. The next step is their asbestos exposure summary. This is their statement in support of claim. The first thing to know about the asbestos exposure summaries is do not assume that the VA knows anything about how the veteran was exposed to asbestos based on their MOS, branch of service, or duty location. I can't tell you how many veterans I've spoken to in the past 7.5 years since I've been doing this that said, I filed my claim, it got denied, I've been diagnosed with asbestosis or mesothelioma, and the VA denied me. I worked in a boiler room for 8 years aboard a Navy ship. How do they not know that I was exposed on the ship? Well, the short of it is, the VA doesn't do a lot to develop these claims. It's up to you and the veteran you're assisting to provide the 5 W's and how the veteran was exposed. And we want to be able to reference specific duty location, ships, and specific equipment that they worked with. Obviously, if they're in contact with people that they served with, buddy statements and pictures, if possible, can go a long way to helping. And these photos that I have here on the lower left is, a picture from, the last 20 years where an M60 machine gun range where either the range NCOIC or the assistant gunner is changing out the barrel with an asbestos midden. I had those asbestos middens on my M1A2 Abrams tank as part of our BII. I used the asbestos midden in the tank commander's hatch as a pad, as a pillow to rest my head when we're doing field exercises overnight to get a couple minutes of sleep. As I mentioned earlier, all wheeled vehicles contained asbestos, brakes and clutch components on the deuce and a half, 5-ton, quarter-ton, before the MTV, LMTV series of vehicles. And then the pictures on the lower right are pictures of pipe lagging from a Navy ship. Those pictures were taken on the USS North Carolina in Wilmington, a decommissioned ship that's now a museum, but the asbestos is still present on that ship, as it was on every Navy ship that was commissioned and laid down before 1983. 1983 is the date that the VA uses for a ship that was constructed before 1983 is assumed to have asbestos. Constructed after 1983 is considered to probably not contain much asbestos at all. So when we talk about MOSs and asbestos exposure, the only list that the VA has and uses is this link from the M21-1 with MOS handouts for job ratings for the Navy. They don't have it for any other branch of service, but it's based on the probability of exposure to asbestos. And they rate it as minimal, probable, or highly probable. The job ratings that worked in engineering spaces below deck fixing things are in the highly probable. If they're above deck or they were moving throughout the ship, fixing things, it's probable. And if their job was not to fix things, it's listed as minimal exposure. This is only a starting point. Just because they had highly probable exposure doesn't mean that the VA will concede that they had the majority of their lifetime exposure in service. It means that the VA will concede that they had exposure, but they still have to be able to prove that they had more exposure in service than during their civilian work career. And we'll talk about how to do that. These are the questions that every veteran that I talk to, that I ask them. I talk to several hundred veterans every year. I've assisted on about 1,500 asbestos-related claims over the past 7.5 years, including about 300 mesothelioma patients. And the first question that I ask a veteran who's inquiring about an asbestos-related claim is, do you think you had more exposure during your service? I typically get a couple different answers. It's either yes, I know exactly how I was exposed, I can tell you the name of the equipment and the manufacturer, and I have pictures. Or it's no, I definitely had more exposure during my civilian career. You know, I was a light infantryman in the Army for 2 years in the 1970s, and then I worked in construction, working with asbestos insulation for the next 15 years. So the ones that are definitely yes, we're moving forward with. The ones that are definitely no, we explain that they're not going to qualify based on the VA's decision criteria, and I can explore to see if there's any civilian resources that they may be eligible for. The majority of the men and women that I talk to say, I'm not sure. I think I had some exposure in the service. I may have had some exposure as a civilian, and that's when we start digging deeper. My next question is, where, when, and how were you exposed to asbestos? You know, if they served on a Navy ship or in the Coast Guard, we start off with that rating. Is it highly probable, probable, or minimal? And then we start digging deeper. If it's a highly probable job, you know, they were a machinist mate, they were a pipe fitter, they were a hull technician, they were a boiler technician, we know how they were exposed. They worked in the boiler room, they re-bricked the boiler, they replaced lagging, a machinist mate is repacking pumps, replacing flex gaskets. We know that their job every single day involved working with asbestos materials. And then it's just getting the details and quantifying that to show how much exposure they had. I have examples of asbestos exposure summaries for every branch of service, and at this point, probably about 85 different job specialties. So if you're working with a veteran and writing an asbestos exposure summary, let me know. I can send you an example to use as a template that can help speed up and make the claim a little bit stronger. We want to know if they served in the Navy or Coast Guard, did they spend time in a shipyard or in a dry dock period for an overhaul or maintenance period? Especially if their exposure was minimal, according to the VA's MOS probability list. If they were in a dry dock period or in a shipyard, they may have had a lot more exposure than their MOS would suggest. You know, they could have been a yeoman or a mess sergeant specialist, but during the dry dock period, they were standing fire watch for welders and shipyard workers in the engine room or in the boiler room where they were replacing lagging or welding pipes. In that case, they had the same type of exposure that one of those highly probable jobs would have had during that period. We also want to know what type of equipment they worked with. It is much easier to connect asbestos exposure to a particular piece of equipment that the veteran worked with than it is to a building or a base. If they worked with a specific vehicle, a specific piece of artillery, a helicopter or fixed wing aircraft, if they worked with something that may have contained asbestos and their job was to maintain it, to perform preventive maintenance checks and services, to work with mechanics in fixing or repairing it, we can show that they had direct exposure to asbestos. As I mentioned, every wheeled vehicle across all branches of service before the early to mid 1980s had asbestos brakes. So if they were a vehicle driver, if they were a crewman on a tracked vehicle, if they spent time in the motor pool, if they did maintenance on a weekly basis, like my tankers did, I mean, every Monday was command maintenance day for 7 or 8 hours in the motor pool, you had exposure to asbestos. If they worked with insulation, if they did construction or demolition, if they served in a combat zone where they were around battle damaged equipment or buildings, they may have had exposure to asbestos. Sometimes I've worked with a couple of veterans who's in their MOS did not have any known exposure to asbestos. This is primarily Army veterans who didn't serve in a mechanized or heavy unit. So they were primarily walking with a rucksack and a rifle, not a lot of exposure to asbestos there. But sometimes there was a work detail for the sergeant major's detail or the chief gunnery sergeant's detail where they were working in an area to demolish a building or tear down the base theater or do a renovation. I had one 11 Bravo light infantry guy who was at Fort Benning in the mid to late 1980s, and he was an E5, and during the last few months of his enlistment, he was made the NCOIC of a work detail, removing asbestos insulation from under the lower enlisted family housing. They gave him a pair of issue leather gloves, a garbage bag, and a dust mask, and for several months, he crawled underneath the base housing and ripped asbestos insulation with his hands, crawling on his back, filling up the garbage bags for several months. He developed asbestosis 30 years later, and we were able to get him service connected because he could show that even though his MOS wouldn't suggest that he had exposure, he did work with asbestos directly on this work detail. There's also sometimes the veteran says, I have no idea where I was exposed to asbestos. If they're diagnosed with asbestosis or with pleural mesothelioma or peritoneal mesothelioma, they may not know where their exposure occurred, but they had exposure. So then we can start digging deeper. A couple of years ago, I had a dentist, an Air Force dentist who was diagnosed with peritoneal mesothelioma. He had no idea where he may have been exposed. We started doing some research, and when he was an active duty dentist in the 1960s in the Air Force after dental school, he used a powder, an asbestos plaster, or there was asbestos in the plaster powder that he used for making molds of teeth. And he would mix the powder by hand, add water when he was making molds for the dental practice on post. That was his only known exposure, and we were able to get him service connected because we were able to show that he had direct exposure to loose asbestos powder, didn't wear a mask or anything when he was doing this in the back workroom, and mixing it. So sometimes we can dig deep and figure it out. Also had an Air Force sergeant who was a print specialist. He served on a base, and he printed the post newspaper and the posters, the publications. No known exposure. We started doing research about the printing press that he used, and it was a linotype press that had asbestos brakes to stop the printing press. He had to do weekly maintenance on the printing press where he would blow the dust off of the brakes on the printing press. That exposure, doing that week in and week out for several years, caused his mesothelioma cancer. So if you're working with a veteran, let me know. It may be a situation that I've spoken to before. The next step is finding out what type of work they did before and after military service. And this is the key. After we've proven that they had exposure in the military, now we need to show that they had more exposure on active duty than they did as a civilian. We want to know if they received any training or personal protective equipment for handling asbestos, either in service or in their civilian career. This is important because in 1983, OSHA, the Occupational Safety and Health Administration, passed legislation that put the liability and responsibility for protecting workers on the employer. It took it away from the asbestos manufacturers and put it on the employer. So as a result, most large companies like Ford and GE, General Motors, who had big plants that used asbestos, stopped using it in the early 1980s because they did not want to be held liable for their exposure. That's right here, this OSHA asbestos regulations. 1983 is the key. Each one of these regulations lowered the permissible exposure limit. How much asbestos was allowed to be in the air for workers to be exposed to. So a lot of veterans had exposure in the military, didn't know anything about the dangers of asbestos. They learned a trade or learned a skill. They went into a similar trade after their service. You know, the classic is the wheel vehicle mechanic in the military who then becomes a mechanic after service, or the pipe fitter in the Navy who becomes a plumber after service. They likely had exposure in both places, but after 1983, it is less likely that they had exposure as a civilian. So if we're looking at a veteran who may be 70 years or so old or so now, that enlisted in the Navy in 1968, served 4 years in the Navy, 68 to 72, we can show that from 72 to 83, if they worked at Ford Motor Company and where they used asbestos brakes, they likely had about 10 or 11 years of exposure. But after that, even if they worked there for 30 years and retired, the second 20 or the final 20 years of their work at Ford, they probably didn't have much exposure. And why that's important is that not all exposure to asbestos is equal. And this is what we want to show to the VA. For example, the VA is just going to look at the number of years. 4 years in the Navy, 30 years at Ford, they had more exposure at Ford, is what the VA is going to say. But we can show that not all of their exposure to asbestos is equal. A year on a Navy ship, you're on that ship basically 365 days a year, 24 hours a day, 7 days a week. You have over 8,000 hours of exposure to asbestos. Subtract out some shore leave or block leave for the holidays, you still have about 8,000 hours of exposure. Versus a year working at that Ford factory, approximately 50 weeks a year, 40 hours a week, is only 2,000 hours of exposure. So that veteran who was on active duty from 68 to 72 has over 32,000 hours of exposure in the Navy. But from 1972 to 1983, those 11 years are only 22,000 hours of exposure at Ford before Ford instituted safety protocols and reduced the amount of exposure. So those 4 years in the Navy are more exposure than those 11 years at Ford. So breaking it down to the number of hours or number of weeks or number of days of exposure and illustrating that in the asbestos exposure summary has been something that's been successful for several of the veterans that I've worked with that had military exposure as well as civilian exposure. That is strongest for veterans who served on a ship, either on a Navy ship, a Coast Guard ship, and for some veterans who were on a troop transport ship going overseas. You know, a guy who rode a troop transport for 2 weeks to Vietnam and a week back, those 3 weeks can add up and be part of their overall exposure portfolio, for lack of a better word, when submitting this to the VA. And there's a link here to the laws from OSHA. It's sometimes we've showed and printed those off and included it in an exposure summary to show the VA when those regulations were passed and how the veteran had less exposure after the OSHA regulations were implemented or instituted at their facility, at their civilian facility. In every exposure summary that I write, there's a couple key phrases that I include. The first is just stating that during their military service, they were never informed about the dangers of asbestos, and no breathing protection or any protective gear or clothing was supplied. That applies to the majority of the veterans that I work with. I recently was working with a retired senior chief, Navy senior chief, who began his career in the early 70s. He retired in the early 90s. And he said for the first 10 years of his career, for the first few ships he was on, he didn't get any breathing protection. But he remembers receiving information about the dangers of asbestos and then having less exposure in the second half of his career. For a younger veteran, that may apply. For most of the veterans with shorter periods of service, they didn't have any information about the dangers of asbestos while they were on active duty. I worked with a retired Navy captain who commanded a ship who was diagnosed with mesothelioma several years back. And he said he had no idea about the dangers of asbestos on the ship, even when he was the captain of the ship, had no idea that it was dangerous to him and his sailors. The second part is going to refer to the latency period. When I first started doing this 7+ years ago, I had a few claims kicked back by the VA stating that the veteran was not diagnosed with an asbestos-related illness while they were on active duty, didn't complain about it, and there was nothing in their active duty medical records. So I started taking a section directly from the M21-1, and it reads, my military records during my service in the Navy, or whatever branch of service they were in, will not show any asbestos-related diseases due to the long latency period. This is consistent with M21-1, Part 8, Subpart 3, Chapter 7, Section A, general information on claims related or claims based on exposure to asbestos. And this is the quote straight out of the M21-1. Many people with asbestos-related diseases have only recently come to medical attention because of the latent period for development of disease due to exposure to asbestos ranges up to 45 years or more between first exposure and development of disease. This means that almost no one is diagnosed with an asbestos disease while they're on active duty. Out of the 1,500 veterans that I've worked with, 2 were diagnosed with mesothelioma, peritoneal mesothelioma, which generally has a little bit shorter latency period, while they were on active duty. And one was a 22-year Navy veteran, and one was a 21-year Air Force veteran, a maintenance chief. They were both diagnosed on active duty. Every other veteran that I've worked with was diagnosed with an asbestos disease long after they retired, ETS'd from the military. Once I started putting this phrase in all of the asbestos summaries, I've only had one get kicked back because they said that they weren't diagnosed on active duty. Obviously, the VA made a mistake on that. They just didn't consider or read through the entire claim, which we know sometimes happens. But I'd recommend, if you're doing an exposure summary, to include this. So once the VA approves the claim, they have a good diagnosis, a good nexus, medical nexus, and a well-written exposure summary. And the VA has now acknowledged that, yes, this is a service-connected disability. The most common conditions caused by asbestos are lung diseases, breathing problems. The VA is going to rate all of those respiratory problems, lung problems, based on the results of their pulmonary function test. How much lung capacity has been lost due to that lung disease? There are different criteria for and different ratings for restrictive lung disease, including chronic pleural effusion and fibrosis or pleural plaques, and interstitial lung disease, which includes asbestosis. The VA is going to rate them just based on the pulmonary function test. For any active cancer, as we know, they get a 100% disability. One thing to note about mesothelioma is that there are people who have longer survival. I talked to a veteran a few years ago who was a 15-year survivor of pleural mesothelioma. He was service-connected, had surgery in Boston 15 years earlier, had 4 recurrences in the 15 years. Like I said, it is a terminal, non-curable cancer. It will keep coming back. It's impossible to remove all of the cancer cells, even with a successful surgery and treated with chemotherapy or immunotherapy. Those cancer cells will continue to grow. And maybe a few years before they present again, but it will come back. He was calling me because the VA was taking away his 100% rating because his most recent scan didn't show any active cancer. We were able to give him some information so he could get a letter written from his oncologist stating that mesothelioma is a terminal disease. It's not like other cancers. And even though he wasn't actively receiving treatment for the cancer, he still was a cancer patient and still was considered to have cancer. So that's just one thing to note if you're dealing with a long-term survivor of mesothelioma. They should not lose their 100% rating. As I mentioned earlier, if the veteran has asbestosis and it reduces their lung capacity, eventually it's going to affect their heart. So if they have a lung capacity of greater than 80%, they're going to get that 0% non-compensatable rating. And it goes 10, 30, 60% from there. But if they have pulmonary hypertension or they have cor pulmonale, that heart disease caused by their lung disease, or if they require outpatient oxygen therapy, they get a 100% rating. So that's something to note, that their forced vital capacity, or DLCO, may show that they only receive a 60% rating or 30% rating. But if they have one of these heart conditions caused by their lung disease, they should be getting that 100% rating. So that's just something to keep in mind, to note when you're filing the claim that the veteran has pulmonary hypertension or cor pulmonale caused by their lung disease and should be considered a 100% rating. Let's help the VA rating officer make the right determination by providing that information in the initial claim if we know that. All right, I know that we've covered a lot in the last 50 minutes or so. The bottom line is, if you're working with a veteran who has been exposed to asbestos and is looking for more information, has been diagnosed with an asbestos disease and is looking to file a claim, or if they need help connecting to civilian resources, we are here as a resource. We're a free help center. We don't charge anyone for our services. As an Army veteran myself, my goal is to help you and to help the veterans in your community. I know that you are all expected to be experts in hundreds of different medical diagnoses and different benefits through the VA. I focus on asbestos disease every single day. So if you have a veteran who needs help connecting to resources, or you have a question, please let me know and I'll try to help in any way that I can. The easiest way to get in contact with me is to email me. I have digital resources. I have those examples of nexus letters, exposure summaries, information about medical studies linking different cancers to asbestos that can be helpful in submitting a claim or providing to a doctor to help them write a nexus statement. You should have all received an email yesterday, and I apologize for sending out multiple. But one of the emails yesterday had an example nexus letter, an example exposure summary, and information from the war-related illness study group talking about asbestos exposure across different services. And that had that 1983 date for the Navy. Ships commissioned before 1983, veterans were exposed, as well as veterans working on vehicles, on motor pool, in construction, and working in shipyards. So that's a document that can be helpful for your own information, but can also be included in an application to the VA to help educate the rating officer as they're making a decision. If you'd like materials or books sent to your office, send me an email with your shipping address, and I'd be happy to send out some materials for you as well. I'm going to see if there's any questions. You can put them in the chat. I'll try to pull that up. But this concludes our presentation today. I thank you all for participating, for being here today. And if there's anything that I can do to help, please let me know. All right, I don't see any questions in the chat, so I'm going to go ahead and close this out. If you have a question, please email me or give me a call, and I'll try to help in any way that I can.